Hi, my name is Debby Houston. I am a licensed independent mental health practitioner, and I have worked in acute care psychiatric for 23 years and private practice for 18 years. I've worked with many people with obsessive compulsive disorder, and I want to let you know that you can get help. Did you know that the average time between onset of symptoms and getting help is 10 years for people with OCD? This means that people often suffer in silence for as long as 10 years. Obsessive compulsive disorder is an anxiety disorder marked by unwanted thoughts called obsessions and urges to make them stop called compulsions. OCD can best be described as brain pain by the people who have it. Now, common obsessive thought patterns involve fears in many of the following categories: fears of contamination, fears of causing harm to others, fears of behaving in a socially unacceptable manner, scrupulosity, which means moral doubt, feeling like things are not complete, fears of losing something of value. Compulsive behaviors often fall into the following categories: cleaning, checking, counting, finishing, hoarding, collecting, organizing, and creating symmetry. Adults who experience OCD have the benefit of recognizing that they have issues and they can ask for help. Children, on the other hand, rarely have this insight and therefore are often victimized by their own OCD manifestations. As a therapist, I became aware of the lack of resources to help children with this disorder. I have recently published a book called Mervous Tames OCD to help therapists, teachers, parents, and children understand this disorder and how to work with the symptoms. I've included in my book an educational page that has an instruction sheet describing what this disorder is. In it, I also go through the various kinds of obsessions and compulsions that people often have. Now, in the back of the book, I have a series of discussion questions that teachers can use with students, or therapists can use with clients, or parents can use with children. In this book, there is a story of a little boy named Mervous, who suffers from fears of contamination, issues of symmetry, and issues with order. Mervous goes to visit Dr. Deb, who helps him to work to overcome his OCD brain bully. We use the idea of a bully being the essence of the OCD that taunts Mervous. Dr. Deb uses 3 strategies to help Mervous gain mastery over his symptoms. Dr. Deb uses cognitive therapy, exposure therapy, and response prevention therapy, all of which are well-researched strategies to use to reduce symptoms of OCD. I believe this educational tool will help anyone who is working with children to understand this disorder and to learn specific therapeutic strategies that can make a difference. This book, Mervous Tames OCD, can be purchased at www.xlibris.com/bookstore. The cost of the book is $21.99. I also want to ask you to consider going to my Facebook page named Mervous Tames OCD. On this Facebook page, you will find articles to help, checklists for symptoms, and various other aids to help understand whether or not you or your child might be experiencing symptoms of OCD. So I invite you to go to my Facebook page, Mervous Tames OCD, and like it. Thank you.